In this video, I'll be showing you how to whiten your teeth at home with a clear retainer or Invisalign tray, some teeth whitening material, and some time. It's super easy, effective, and safe, so here we go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about teeth whitening at home with a clear retainer, Invisalign aligner, or a clear custom tray. Any of those can be used. You also need whitening gel. I prefer the 10% carbamide peroxide, which is an overnight whitener, 4 to 10 hours a day. I like that one because it decreases the amount of sensitivity. Yes, teeth whitening does cost a little bit of sensitivity, so your goal is to make sure you minimize it as much as possible. You can also get a higher concentration of teeth whitening gel. Of course, you're gonna get higher sensitivity with that. I'll go into more specific detail on that later in the video. And then you also need a brush to clean the whitening gel out of the tray, so that way it's not still in there for the next time. So let's go more into details on the instructions. The first step of the teeth whitening process is to brush and floss your teeth. You need a clean surface for the whitening gel to interact with your teeth. If there's any food or plaque or tartar on the teeth, then that area cannot whiten and then it's not doing its job. The next step is to place a small drop of the whitening gel on the front surfaces of the trays only. You only need to whiten the front. You don't need to whiten the backs of the teeth. So most people only whiten the front. That way it's going to decrease your sensitivity and also make sure that your whitening gel lasts longer. And then also I do recommend placing the whitening tray in your mouth when you're looking at the mirror, so that way you can wipe any excess off. You don't want to see any whitening gel go into your gum tissue. It could cause a little bit of a burn on the gum tissue. You want to avoid that. So any excess, wipe it off. Here's some whitening tips. The amount of time that you whiten your teeth depends on the concentration of material. I like the 10% carbamide peroxide, which is a 4 to 10 hour teeth whitener, with a 6 to 8 hour being the sweet spot. That's overnight. You're sleeping while you whiten. Super easy to do that. If you choose a higher concentration, there's a little bit more sensitivity. Also, you're going to decrease your time. So a 35% material is going to be a 30 to 60 minutes. So less time, higher sensitivity. You might err on the side of caution and go with a lower concentration, which is the one I prefer and recommend. You're also going to brush and clean your teeth after you teeth whiten. So in the morning or maybe during the day, get all that whitening stuff off your teeth and the tray. Immediately after you whiten your teeth might be sensitive to hot, cold, or air. That is normal. That's because your pores are open. There's pores in teeth. They're open. And so you have to wait a little bit of time for that to close. It usually takes maybe an hour for that to close. And during that time, you want to limit the drinks that can stain the teeth, coffees, orange juice that has acid in there, sodas, teas, anything like that. So stay away, water only for about an hour after whitening. So let's watch a video on how to put the gel in the tray. Let's go. All right, let's go through a tutorial on how to place the whitening gel inside the tray. We're going to start with a pin head size drop of the whitening gel on the front surfaces of the teeth. It's a large pin. It's not a small pin, especially if you're bleaching the front upper teeth. Upper teeth are bigger than the lower teeth, so I might use a little bit more material on the upper versus the lower. We're only putting on the front surfaces. As you can see, we're not whitening behind the teeth. We're not whitening the tops of the teeth. We're only doing the front surfaces of the teeth. And so the bigger the teeth, the more gel. So here we go. There's a molar right here. So we're going to use a little bit more on that one. I think I'm going to the molar on this one as well. So that's bigger than a pin head size right there. So that's a little bit more. And so, yeah, just you express a little bit at the with it out of the mouth, and then you put it in. You kind of do a little scraping motion, and that's how it stays in. And that's how you put the whitening gel on the trays. All right, let me show you what it looks like when you put the whitening tray inside your mouth. The gel should spread uniformly over the fronts of the teeth. It shouldn't be too much or too little. So right there, you can see that the gel is uniform, perfect. That looks really, really nice. You can see that there's a small layer of whitening gel over the fronts of the teeth. And then if anything was going to the outside, then you could wipe it off with your finger or paper towel. So it looks great. All right, let's wrap it up with some common questions I get regarding teeth whitening. Can I whiten during orthodontic treatment? If you have braces, the answer is no. If you have Invisalign attachments on your teeth, the answer is usually no. They do say that sometimes the whitening gel can get underneath the attachments. That is at your own risk if you want to do it or not. I generally just say wait till you're completely finished, wait till all the attachments are off the teeth, and then you can start your teeth whitening at that point. Can crowns and fillings whiten too? The answer is no. You cannot whiten your crowns or your fillings. Make sure you do your teeth whitening before you get any permanent dental work. How do you store the teeth whitening gel? Some people put it in the refrigerator. I find that these whitening gels do have a expiration of years. It's usually like 5 or 6 years. So, room temperature is fine, but if you want to be a little bit more cautious, go ahead and put it in the refrigerator. How can you reduce the teeth sensitivity and the gum sensitivity? Well, obviously for the gum sensitivity, just don't let the gel get on your gum tissue. That's easy. Teeth sensitivity, that's when you're gonna titrate yourself on the amount of time. So if you have a 10% carbamide peroxide, you could do that one at 4 hours or 5 hours or 3 hours or 2 hours. You can decrease it from there if you want to decrease the sensitivity. So that's what I would recommend. So instead of doing it overnight, just do it for a few hours during the day. And then how many uses can you get from a single syringe? So one of these little syringes that look just like this, I'm finding that you can get 4 to 5 usages. That's top and bottom. So that's sessions of teeth whitening. So with a 2-pack like this, you would get 8 to 10, or a 4-pack, 16 to 20 nights of teeth whitening. And then how long does it take to get results? Of course, that's going to vary. Depends on the color of your teeth, the shade, whether it's yellow or grayish in shade. Yellow, of course, is going to be the easiest to whiten the teeth. I usually find that it's going to take about 8 to 10 nights of teeth whitening just for you to see a long-lasting benefit. Of course, I usually have people go the full 16 nights. I find that that's the best. So that's 4 syringes total to get your teeth whitened. Thank you guys for watching the teeth whitening at home video. Hopefully you found it useful. Hopefully you can use these same techniques at home and get great results. I do use Invisalign retainers and Invisalign trays for all of my teeth whitening in my office. I do like the 10% carbamide peroxide over all the other concentrations because I feel like it's safe. It lasts longest, decreases the amount of sensitivity. It's the best one. I think it's the most widely available for at-home usage. So if you guys like this video, don't forget to comment and subscribe, and I'll see you in the next one.